It's a great pleasure to have Pietro come and speak again with factors affecting the in vitro or embryo production in cattle. Pietro Baruselli.
Thank you. Hello. So thanks very much, Charles, for inviting me to be here again. It's a great pleasure to talk about factors affecting in vitro embryo production in cattle. And I would like to thank also Charles. Charles, you have been in Brazil several times in our Brazilian Embryo Transfer Society, doing a very good job and presentation. Thank you for coming there also. And it's a pleasure to stay here also talking about our technology we are trying to develop for the Brazilian system. So again, I will work here, you know about that, but I will introduce this because I will show you data that we are doing in collaboration with all these IVF lab that we have in Brazil. So this IVF lab collaborates with São Paulo University, and I will show you different researchers doing with this lab that we use to produce the embryo from different study or category, and I will present to you now. So what I prepared to present to you, I prepared to present to you the different developmental and reproductive stage and OS quality and in vitro embryo production. We will start to our research that we produce an embryo for calves, 2 4-month calves. These calves that we produce doing this research was Bos Indicus, that you have only Brahma here, but we use also Holstein as Baustaurus. So I would like to show you the data that we are doing using heifers as trying to understand the oocyte quality in vitro embryo production and fertility. So prepuberal heifer compared to puberal heifer compared to pregnant heifer. I would like to show you the data that we have in our lab looking for the oocyte quality after calving, at the early lactation, and after compare alien and late lactation. And I would like to show you also the data that we have in non-lactating cow, Taurus and Indicus compared there, and the effect of the nutrition and the high energy and oocyte quality in this category. So more or less is this that I would like to show you. And at the end, I would like to show you also the effect of the anti-melanin hormone and the oocyte quality number and the in vitro embryo production, the fertility, and also after embryo transfer and after AI according to anti-melanin hormone. So this is the presentation. We will start in this phase here, in the first phase. So we, in the last 5 years, we start to work trying to understand the oocyte quality of calves. So why we are doing that? You know that this is the genetic intercalving of generation. Of course, if you have a 2 years donor, with our intercalve of generation is 3 years, to imprint some milk production, something we need 15 years, but if we use calves as a donor, we can have 1 year intercalving generation. It's possible to decrease a lot the genetic between these animals. So this is a work that we are doing in collaboration with In Vitro in Brazil, and with also another company that Julio is doing with us this collaboration. So what we did, we collect the oocytes from calves, 3 months calves, without FSH or without FSH to simulate. And all this analysis we do using a positive control. So a positive control here that we did the same day the aspiration is a puber heifers. So we collect using laparoscopy, and here we collect using OPU. So this is the model. The calves with FSH, and we use a seeder for sheep, a seeder to do a progesterone priming. Here's the positive control as a control group. Here's the donors. This is in São Paulo University. We have a farm there when we use the donors. Here's my student doing the preparation for the aspiration. Here's Julio doing the laparoscopy aspiration. And here's the donor. After the laparoscopy, they come to their mothers, and no problem. We aspirate more than 200 animals, no problem for the health of the donors, okay? So this is the data, some data that we compare in the same day, in the same situation, calves with FSH, without with FSH, in cycling heifers. As you can see here, the cycling heifer, we have a high efficiency, of course, in the IVF semen. Remember that you have the same lab, the same day, the same semen. The difference here is the category. And you can see here that when we use FSH, we improve the number of follicles and number of coccus recovery when using calves FSH. And you can see here we can produce 2.3 embryos per OPU when you use FSH in these different cows. Of course, in adult animals here, 9 embryos per. Remember that this is per OPU. This is zebu, né? Zebu, you know that we produce a lot of embryos. So we transfer these embryos, and look here. This is the conception rate in the recipients when we transfer the embryos for cycling heifers. And here for calves, look, a good conception rate. So we can produce embryo, we can produce conception rate. Look, this calves was born using, the mother has 2 months, you know. Né? We have a lot of calves born in this technology. No problem with embryo mortality that we can now show you some information that could reduce the efficiency of this technology. Of course, the quality of the oocyte is not so good, and we need to improve the efficiency. So we did this also in hosting. This is the hosting in our university also. The positive control was puberal heifers. And look here, again, we did the same protocol in this experiment using the positive control here. And look, the donors, these is our donors. We introduced a seeder sheep that we have in our market. This is the donors that we are using for in vivo embryo oocyte collection. Julio did all the collection for us. Like sheep, very similar to sheep. Here is the donor after the collection. They 1 hour before, they are good, no problem, no problem in the efficiency. Look again here. Look, when you use FSH in hosting, we have here 54 follicles, visualized follicle when you use FSH. 22 oocyte we recover per calves. But of course, in hosting, the efficiency of IVF is lower than in the blastocyst rate is very lower here, but also in heifers. But we produce in this experiment here 0.7 embryo per OPU in hosting. We did again another experiment here. We produce here in calves 0.9 and in heifer 2.1. So look around we are producing around 1 embryos per in hosting. 2-3 embryos in Nelore and 1 embryos per hosting in this situation. So this is the first birth that we have in São Paulo University some years ago. The mother has also 2 years old, and the 2 months old, sorry, and she's born in our situation. So if you would like more information about that, we publish in Domestic Animal Endocrinology this paper showing the efficiency, and also we measure plasma anti-Müllerian hormone, and we can select also the best calves donor using this technology that I will talk with you at the end, okay? So just a curiosity, we are doing also in buffalo this technology. This is our donors. They are 2 months or so. So we are using the buffalo for look at over here, super stimulated with FSH. Look at the follicle at the moment of laparoscopy. The positive control for in our study is also adult buffalo. But just to show you, this was 2-3 months ago. The first 2 gestation, we transferred 5 embryos for calves, and we got 2 gestation. 2-3 weeks ago, we confirmed they are there. So what we are doing this? We are doing this because in São Paulo University, we have a problem. We have 2 years ago, we need to slaughter more than 150 buffalo because they got tuberculosis. Now we are need to recompose our herds. So what we are doing, you know that if you use a high genetic buffalo, and now the buffalo farmers, they give to São Paulo University beef recipients, and we are introducing in this beef recipient a high genetic with calves, so we are identifying the best buffalo in Brazil, and we are doing in the first generation, we are doing our herd in São Paulo University using 100% embryo transfer in calves. Why calves? Because we have the best genetic. So we are trying to have herds now with high genetic using this technology in São Paulo University. Okay? I talk about calves. I would like to talk about prepuber and puberal heifers. This is another work that we are doing. So I will start with Nelore. We collect in the same day prepuberal animals, pubertal animals, and with 18-22 months, and prepubertal into 0-12, 18-22, and pubertal 22-26 months. It's in the same day. We use the same semen for this collection. It's 20 collection per in this experiment. And here is very interesting because, again, when we analyze here the age, so 8 to 12 months compared to 18 to 22 months, we have an improvement in blastocyst production. All them is prepuberal animal, but the animal that have 18 months produce more embryo than the animal that have 8 to 12 months. So look here, 1.5 to 4.5. And when we compare by our orthogonal analysis, prepuberal compared to puberal, again, all the analysis improve when we have a pubertal animal compared to pubertal animal. So again, the young animals, they produce lower IVF production compared to cycling animals or animals that is more have the age, improving in the age compared to the young animals. We did also this in Holstein. We compare, this is Bruna thesis that did a master thesis with us. We compare, look, it's 32 OPU per groups in the same day, the same moment. Heifers, prepuber heifers, 8-10 months. Pubertal, 12-14. Lactating cow and non-lactating cow, the same day. We, of course, use the same semen for produce this in fiber replications. And look here, the data, 30 OPU. And again, if you look the cleavage rate, blastocyst produce and blastocyst rate is lower in prepubertal animals and improve according we improve this category here. Again, the prepubertal and pubertal produce lower than lactating and non-lactating cow using the same model, the same semen, the same day. Here we transfer the embryos in the same day in the recipients and look the conception rate from the IVF embryo produced by non-lactating cow, by lactating cow, by pubertal and prepubertal, 0 conception rate in prepubertal. So we can understand better what's happening here, but the young animals here hosting are producing lower than adult animals in conception rate also. So this is another experiment that we did. This is Lais, my PhD student. We did the experiment looking for donor category. This is in vivo embryos. We select, here's with Carlos Rodriguez. So I will show you data from the farm. We did a retrospective analysis, but the same vet, the same farm, the same condition. We analyzed the embryos for 2,300 embryos for heifers and 1,007 embryos for lactating cow, all transferred in recipient, but all the recipients in the same herds, and all the recipients are lactating cows. So 4,000 embryo recipients that received this embryo for donor, that the donor was or heifer or lactating cow. And like in IVF embryos, look here, when we transfer the embryo for the heifers, statistically, we have a low conception rate in 30 days and 45 days, no different in the embryo loss. But again, the lactating donor produce more conception rate when transfer the embryo than heifers again. And so the heifer have low conception rate in our condition. So what we are trying to do, we are trying to improve the efficiency of the conception rate from the heifers, prepuber heifer. This is an experiment that we did in São Paulo University. This is a farm from our university. All these heifers here, our donors, they are non-cycling, are prepubertal heifer. What we did, the control is a prepubertal heifer. In the same condition, we did a short progesterone prime. We did a short and long progesterone prime and did the OPU, and is a positive control, is cycling cow, looking for the effect of the progesterone in the oocyte quality in prepubertal animals. We did it there in São Paulo University. Here we are surprised when here's the cows. This is blastocyst rate. Look that when we did no progesterone or a short progesterone prime, we have a lower blastocyst rate than when we expose the animal for progesterone before OPU. So this is an experiment that could improve the oocyte quality from heifer. But at the end, the number of embryo produced per OPU didn't change again between the groups, because here we produce lower number of oocyte than here. But we improved the quality when we did a prime of progesterone in this situation. So what we are trying to do also is treat the pubertal with FSH. This is an experiment that we are doing using FSH in prepuberal heifer. This is the protocol. One group received FSH, another group didn't receive FSH. And we can see here, when you use FSH, we improve the cleavage, the blastocyst rate, and the number of blastocysts per OPU when using FSH in prepuberal heifer. And we can see here, we, of course, in FSH group, we change the proportion of follicles 6-10 millimeters. Here's the control group in black. Here's the little follicles. And here, when you use FSH, now we have in this prepuberal heifer, 60% of follicles aspirate between 6 and 10 millimeters. So probably, you know, in the literature, when we improve the size of the follicle, we can improve the oocyte quality. We think that because of that, but we are trying to understand better this situation. So what we did also, we compared the quality of the oocyte in pregnant and non-pregnant heifers to understand what's happened with oocyte in pregnancy rate. So this is our donor, the pregnancy rate. This is a paper from my PhD student, Bernardo. We published now this in SBT. What we did is 60 OPU per group, and one group is a prepubertal or not pubertal, and another pregnant heifers. The same semen, the same day, the same situation. We try to understand what's what is the effect of the category in the in vitro production. Here is a video just to show you that this is a pregnant heifers that we aspirate. Look at the ovary, a lot of follicle in the ovary. This is just an example, but Bernardo collect 60 oocytes from these pregnant heifers. So you know, who you work with that, you know that we can collect oocyte in pregnant animals also. So this is the result, 6 OPU per group, the same day. We did this experiment with IETA, IETA is here, IETA. If you have some question, could talk with IETA, but look at that here. We pre-pubertal again, very lower efficiency. Pubertal, we improve the blastocyst rate, and look here, the pregnant heifers, we arrived in 37% blastocyst rate compared to the other groups, and look at 0.1 embryo for 1.8 embryos in the same day, in the same situation. So the pregnant cow in this situation are improving. I have a good oocyte quality and good efficiency in the IVF production. Now I would like to talk to you about the early postpartum production. What we did, we collected the 30-day, 40, 60, 7, and until 90-day postpartum. We collected the cows, the same cows, several times, and used the same semen, both in Indicus and in Taurus, to understand what's happened in this OPU and the effect of the postpartum in oocyte quality in beef and in dairy cows. So this is the Rodrigo data. Rodrigo now is working here in the Saxon Technology. He did a master with us. And here's another experiment that we did in Sertãozinho in collaboration with Lindsay groups. So look here, the OPU, we divided the group for cyclicity. When they arrived in 50% cyclicity, we divided the group from cycling on cycling in hosting, and we divided also when arriving in 50% cycling and on cycling in this period here to analyze the effect of cyclicity and the time of postpartum in oocyte quality. It's totally unexpected, but we didn't find any effect in Holstein and in Zebu for number of blastocyst production according to the postpartum, and number of blastocyst rate again according to postpartum. So we expect to improve the oocyte quality according to cyclicity or according to the time of postpartum. Probably we are collecting amount of follicle of 3 millimeters, and probably the metabolic effect in the postpartum is more evident in the dominant follicle that ovulated than in the little follicle. But we didn't find any effect. Just to show, we have very few data in the literature. This is Patilunican data that he found the same that we found in this paper that he published. So this is the postpartum, early postpartum, and later postpartum, no effect on oocyte quality also when he did the IVF in Holstein cow in Ireland like our data, okay? Just to understand the effect of the progesterone in adult animals, we did and published now this experiment here in collaboration with Michael that from University of Sydney in Australia. We have a strong collaboration with Michael. This we did in Brazil. We block the animals. So we have two groups. One group is cycling adult, non-lactating animal, and one group we blocked with desoreline. And of course, this animal here is exposed for progesterone and estradiol. This animal not. We collected this animal we block them using generate agonist. You know that when we block, they don't have LH during a long period. So we use 6 months experiment. We collect in cycling animal and block the animal with desoreline, use the same semen, the same condition for all these analyses. And look here, the desoreline to block the animal, and this is the results. When we use desoreline, of course, the corpus luteum disappear, so the treated animals have long period without cyclicity, without large follicles. And you can see here the data from number of cocks, recovery, and a lot of analysis. But look that when we blocked, we improve the number of follicles that when compared to cycling animals. No effect in the culture rate, cleavage rate, and blastocyst rate in blocked and non-blocked animal for 6 months. And look here, the desoreline produce more cocks because probably the dominant follicle and the corpus luteum, they have some commitment in the day of the aspiration, but no effect at the end. The number of blastocysts produced as a little higher in desoreline, but no effect. So without progesterone for 6 months, we didn't have any effect in oocyte quality. We need to try to understand what's happening in this situation. So now I would like to talk to you about early postpartum and late postpartum. This is a problem that we have in Brazil, mainly in Holstein. What we did the OPU in this phase here, in the early lactation and late lactation, the same day, same situation, using the same personnel and semen and labs. And look here, you need to understand that we in Brazil, we have lower conception rate in Holstein. So we have 30% of our herd have open cows in this phase here. You probably know we have only 10% of cow here, but in Brazil we have 30% of cow here because we have a low conception rate in Holstein. So we need to understand that these differences of management and conception rate, you need to talk with you about this result. This is the farm in Brazil. We have a good farms that produce, have a good structure to produce milk there also, but we have a lot of heat stress and low conception rate, so it's different than you in this situation. So here is the experiment. It is adapted from the Roberta thesis that did the PhD with us. Look here, we collect 70 cows with 34 liters 100 days after calving. And we collect here 70 cows or so. Look, of course, 33 liters because it's in this phase here. And we did the same day the OPU and the embryo production. And this is the situation from the experiment that we did. This is an experiment that we collect this animal. We synchronize to collect them at the same phase of the wave. We did fertilization in the in vitro embryo production. And some part of this embryo, we did a tunnel to understand the development and the apoptosis. We collect the blood for biochemistry analysis, metabolism like insulin and all the part of the metabolism from these animals. And we also collect the oocyte for the gene expression and the RNA8 and DNA8 and the mitochondrial amount in the oocyte to understand what's happening according to these both phases of lactation. This is the animals, this is the experiment. Of course, we, in later lactation, decrease milk production and improve here the body condition score, as you can see here by the analysis. When we produce the metabolic data, you can see here that in the later lactation, we have improving glucose and insulin. And when we did the aroma to understand the insulin resistance, was strong positively for cow in late lactation. Probably they have insulin resistance in this period. When we did the embryo production, look here, compared to late lactation, we decreased the embryo production in late lactation cow. Look here, the blastocyst rate decreased from 33 to 13%. So we have more follicle but lower efficiency in the IVF compared early than late lactation. We did the mitochondrial DNA amount, the expression of mitochondrial-related genes. You can see here that we have a decrease in the expression of genes and in the amount of DNA genes comparing the late and early lactation. And the expression of apoptosis genes related was higher in late lactating than in early lactating. Confirm that the low efficiency of IVF probably is related to the low quality of the oocyte. So we did also AI with the same day, in the same semen in cow that was in the early and later lactation, just to understand if the oocyte quality and the conception rate is lower. Of course, we confirm that the late lactation will have low efficiency than compared to early lactation. So this could be related to insulin resistance. We are studying this now. This is the work for Bob Webb and Sinclair groups in Nottingham. So they use high feed, they improve the body condition, and they have a detrimental effect of oocyte. So this is the first related between hyperinsulinemia and oocyte quality. So what we are trying to do, trying to understand what's happened, this is a Roberto Sartori data that looking for the insulin resistance according to the lactation. So this is the cows. Of course, when we delay the collection, this is the animals. We can see here after when we inject the glucose, so they control the blood glucose, but when the cow arrived in 150 days lactation, they need to release more insulin to control the glucose. This is the related to insulin resistance. So probably the late lactating cow have insulin resistance. So what we are doing, I showed you yesterday, we are doing AI or embryo transfer according to the phase of the lactation. Just to show you the data that I presented yesterday, look that when it transfer the embryos in late lactation or repeat breeder cows, we decrease the conception rate in AI, but probably the uterus is not the problem, because when you transfer the embryo, they have the same conception rate and no difference in pregnancy loss. So if you would like to know a little more about that or some questions, we publish a review article now looking about the association between insulin resistance and fertility in dairy cows. Okay? So now I will talk about the non-lactating cow, the data that we have comparing in Taurus and Indicus non-lactating cow. This is the one of the paper that we published with Ruben. Ruben is here. This is the paper from my PhD student. When we compare the non-lactating and the lactating cow, of course, the lactating cow probably do the metabolic problems in this situation here, produce more embryos, more blastocyst rate and more embryos compared to non-lactating cow, just to show you the category effect. But we can show you also, we treated the embryos also as a 2x2 factorial with FSH, and we improve also the efficiency of IVF in lactating and non-lactating donor cow, treated also then with FSH. But I show you because the category now, this data here. This is another experiment that we published in Journal Dairy Science from Zenelli, did a PhD with us, compared the energy in non-lactating cow and the in vitro embryo production. And this is interesting data because when we improve the energy in the time, you will see that we can reduce the embryo production and the quality of the oocyte. So this is non-lactating cow. We did up-U here for gene expression also, and for glucose tolerance test. And here, when we improve the energy, of course, we improve the body condition, we improve the subcutaneous fat measured by ultrasound, as we expect. We have an interaction. We improve the glucose and we improve the insulin in this animal, of course, using more energy during this time. And when we inject glucose, this is Taurus and Indicus, they have the same profile from blood glucose. This in red is Indicus and in green is Taurus. But look for the insulin again. To control the insulin, look here, this is the Indicus to control the insulin. The high energy, you need a rude improvement in insulin release to control the glucose, and in Taurus is the same, a rude improvement in insulin to control the glucose. Again, probably they are in insulin resistance. We developed the insulin resistance in this animal, okay? And when we produce the embryo, at the beginning, they improve the embryo production, but after 60 days, they decrease the embryo production. So it's a chronic effect of energy. And when we measure the gene expression in the oocyte, you can see here that all the genes is different between high energy animal and low energy animal. So probably high energy animal for a long time improve the resistance insulin effect. So we are trying with, sorry, it's important, but we are doing this hypothesis. We are trying to understand this hypothesis. So high energy, improve the glucose, improve the insulin, down regulation. So we have the oocyte here. We need to transport glucose into the oocyte, having the insulin in the receptor. But when we have the insulin resistance, we have a down regulation with this receptor. We have a decreasing the efficiency of transport. We did a gene expression from in the oocyte from the genes related to transport of the glucose. They are different. So we have a hyperinsulinemia, a high IGF, low glucose in the oocyte, low quality of the oocyte. We are trying to understand better this in experiment that we are doing now. So to finish, I will present to you now the research that we have compared to antral follicle population and production fertility. So we know this is Alex Evans data. You know that we have a rude difference in the number of follicles according to the animals. This is Holstein, according to the animals. You know about that, and you have animals that have a low number of follicles, animals have a high number of follicles. We need to understand if this works published by Ireland group. So the animals with a high number of follicles have a healthy follicle compared to oocyte compared to low number of oocyte. We are trying to understand that, if it's true or not. So this is another experiment did by Alex, showing that the cows that have a high number of follicles have high fertility also in the AI program. So what we did, we did this hypothesis in Brazil that cows that have high follicle population have a high IMH, high IVF production, and high conception rate and fertility. So this is the hypothesis that we did some years ago, and now I will show you the data from the experiment that we did, looking for the antral follicle population and embryo production, quantity and quality, and antral follicle population fertility, doing AI in this animal and look for the fertility for this animal. We did this in Taurus and Indicus. As you know, the zebu, we try to understand the follicular population in beef zebu and beef Taurus and dairy zebu and dairy Taurus, just to show you that you know about that in the same condition, the same situation, the bovines have high number of follicles compared to Taurus. So, when we did the IVF, this is Lindsay work that did a PhD with us. Look here, the Nelore, 42 follicles, and the Taurus in the same situation, 22, a hosting. And look, 7 embryo produced per OPU, and here 1 embryo produced per OPU. Of course, you know about that. There's a rude difference between Taurus and Indicus regarding to IVF efficiency. So we know that hosting, we have a lower number of follicles and lower quality compared to Zebu, high number of follicles and high quality. So what we did, we put in the same condition again, Taurus and Indicus, to understand the plasma anti-Müllerian hormone and to a predictor to ovarian follicular population. Of course, looking for the difference between the genetic groups. Here is São Paulo University, the same food, same nutrition, same age, 2 years, and the same cyclicity, all day cycling. So what we did, we measured the number of follicles, we synchronized, measured 22 in Holstein and 37 in Bos Indicus, as we expected. But when we measure the AMH, look here, very interesting, that 0.3 nanogram per ml in Taurus and 1 in Zebu, 3 times more AMH in Bos Indicus than in Taurus, correlated to this efficiency. So look, high correlation between number of follicles and AMH both in Taurus and in Indicus. And now we did again another experiment trying to correlate. We published in Domestic Animal Endocrinology. This is a PhD from Bruna. Plasma anti-Müllerian hormone as a marker for in vitro embryo production. Our hypothesis is that the cow that have high anti-Müllerian could have more follicle, more oocyte, and more quality of the oocyte in the IVF production. This is our hypothesis. We start in Holstein. Look, follicular population, again, high correlation between anti-Müllerian hormone and number of follicle, viable oocyte recovered, in embryo production. Look, all then high correlation. But when we analyze the blastocyst rate was exactly the same according to MH or follicular population. So a high MH have more follicle, but the follicle of cows with more, the cow that have more follicle have exactly the same blastocyst rate than cow that have a low number of follicle. We did this in Nelore. Look at high correlation between number of follicles, number of embryo production per OPU and per IVF, but again, blastocyst rate exactly the same between animals with a high number of IMH or follicle compared to animals with low number of follicles or IMH. And also here, the viable oocyte rate was exactly the same. So probably no effect in quality, but in quantity of the oocyte we found. We divide the animal with high and low IMH and look exactly the same. When we have, of course, high MH, we produce more embryo per OPU, 1.2 per 3 in Holstein, and in Nelore, 2.47 in Nelore. But look for the analysis for quality. Blastocyst rate is exactly the same according to low and high, and cleavage rate, and blastocyst rate was exactly the same. And cleavage rate and blastocyst rate was exactly the same also in Nelore. So we changed the number, but not change the quality of the oocyte, okay? This is Luiz Gustavo that we are working together in Fazenda Bela Vista. It's a farm in Brazil that has 2,000 cows, and I will show you the data that we did with Luiz Gustavo, looking for the follicular population in IVF and pregnancy rate. And look here, we divided this donor. Here we are talking about around 300 OPU, 300 donor. We divide with low oocyte recover, medium, and high oocyte recover. And look here the data. So 14 follicle, 25 or 14.2. And you can see when we analyze number, of course, we improve the efficiency, but again, when we analyze quality, look, the animal with a high number of recovery rate have the same cleavage rate and the same blastocyst rate, no difference again between quantity and quality of the oocyte. And this is very interesting because we transfer the embryos for a donor with a high number of follicle and low number of follicle. And look at the pregnancy rate here is exactly the same. So the cows that have a high number of follicle have the same conception rate that cows that have a low number of follicle after, of course, the embryo production. We did also another experiment. We transferred 107 embryos that we analyzed the IMH from the donor and transfer from the recipients. And look at the cows that have a high IMH have exactly the same conception rate of the embryos when we transfer the embryo with a high and low IMH. So probably the IMH is not a marker for fertility, but for quantity of the follicle in the ovary. We did also another experiment, try to understand the IMH and the AI conception rate. So we used in this experiment 1,100 heifers and 700 cows. It is difficult to do because we synchronize the animal. In day 5 of synchronization, my student come to the farm and we are take a hair sample for DNA analysis. We are trying to do a marker for number of follicles. But what we did, we count the number of follicles in day 4. We check the pregnancy rate according to the number of follicles in these 2,000 animals. And also we do our ultrasonography to understand the ovulation rate, the size of the follicle according to the number of follicles in the ovary. So this is the data, just to show the difference. Here is a cow with low number of follicles. This is a cow with a high number of follicles. Look at the strong difference in day 4 of the protocol at the beginning of follicular wave. And this is the data in cows and heifer. And here's the conception rate for AI in 2,000 animals, heifer, and look here, the p-value, very high p-value, no effect also in the conception rate in the AI according to the animal with a high number of follicle and low number of follicle. We did also in like 300 animals, we measured the AMH. We divide the population for IMH. Here the population have 0.5 IMH and here 1.6 IMH. We divided and we did the AI. Look here, exactly the same, the conception rate according to the IMH. So we didn't find any effect. We didn't confirm our hypothesis. We expect to have high fertility in this animal, and we didn't have the high fertility in this animal. So the popular follicular population IMH is not correlated with fertility, okay? And the hypothesis that we have at the beginning was confirmed in the number of embryo production, but not confirmed in improving the fertility in these cows that have a high number of follicles. So this was confirmed, IMH and follicle population, IMH and embryo quantity, but not correlated with IMH and oocyte quality, and IMH fertility was not confirmed. Of course, we need to do more study to understand what's happening, but in our condition, we did confirm these results. If you'd like to see, I published a paper in animal reproduction in our society, in Brazilian Embryo Transfer Society, is a review related with relationship with follicle population, IMH, and fertility in cattle. If you'd like to go, it's just to go to the Google Scholar. It's open access. You can use it there in the SBT presentation. Okay? So is that, of course, again, we work in the tropics. Sometimes the result is different than you, but I try to show you what we are doing to improve the efficiency of the industry of embryo production in Brazil. I talk about the recipient, now I talk about the efficiency of IVF and embryo production, and I hope that will be good, some information for you. Thank you very much.